My name is Vallerie McLaughlin. I am a professor of medicine and director of the Pulmonary Hypertension program at the University of Michigan in Ann Arbor, Michigan. So the World Symposium on Pulmonary Hypertension has occurred many times and has made many unique contributions. The first symposium was in 1973, and we did not have another symposium then for 25 years until 1998. Over the past 2 decades, we've had more than a dozen therapies approved for pulmonary arterial hypertension. And these symposiums have led to experts getting together and discussing how we should study these medications, how we should treat patients, where the gaps are, what additional knowledge we need, how to spread the word about specific treatments or specific situations that need to be addressed, genetics, treatment, clinical trial design, and many others. We have founded this association for the World Symposium on Pulmonary Hypertension to keep this meeting going and contributing. Each of our meetings have made important contributions. I'll remember the meeting that we had in Dana Point, California, where the task force on clinical trial design really talked about how we need to move this state forward, how we need to move from just 6-minute hall walk trials to larger endpoint-driven trials that have more clinically meaningful endpoints to patients these days. And after that meeting, trial design changed. That was a huge contribution that was made by the World Symposium, and we need to keep that going. This association will form the basis of us continuing to have these meetings to talk about important topics in pulmonary arterial hypertension and continue to make these contributions every 5 years, really in perpetuity. I have been so fortunate as to be involved in the World Symposium since the 1998 symposium in Evian. I was a very junior faculty then, just presenting some of my initial research. But over the years, I've had the opportunity to be much more involved, to be a task force chairman, and now to even be one of the steering committee members. I think my contributions include really discussing what content there needs to be, pushing the envelope. I've chaired symposia task forces on goals, and that's something that's evolved immensely over the years. And in fact, we've learned that achieving certain goals will improve a patient's prognosis. And at the most recent World Symposium in 2018, we had a whole section of a chapter about achieving treatment goals, and I think this is really evolving how we treat patients. I feel so privileged to be working with Professors Rubin, Gallier, and Simoneau on this association. They're all really legends in their field. Dr. Rubin has been a mentor of mine for many, many years. He's really one of the fathers of pulmonary hypertension. He was writing papers about calcium channel blockers when he was still in training many decades ago, and has really seen this path from beginning to where we are currently. Dr. Simoneau, oh my gosh, he's the leader of the French group, and the French group has made so many important contributions to pulmonary hypertension over the years. They have this incredible database that has produced so many observations, so much literature that has affected how we treat patients. Every day when I see patients in clinic and I think about are they doing well? Are they optimized on therapy? I think about a paper that was written by Dr. Simoneau and his colleagues in the French group, and that helps guide me in making my decisions. They've clearly made incredible contributions to the field. And Dr. Gallier, he's just a leader in the field. He's a giant. He has coordinated the ESC, ERS guidelines over the past couple of rotations that have made really important contributions to help people understand how to best treat pulmonary hypertension. Yeah, I really feel like I've made a lot of contributions to pulmonary hypertension over the years, some in terms of observations, papers that I've written, some in terms of steering committees that I've been on that have led to currently available therapies becoming approved and available for patients. I think one other event that I would like to highlight is the role that I've had in what we call the Pulmonary Hypertension Breakthrough Initiative, which is an important initiative to try to advance the basic science of this disease. We don't have any good animal models for this disease, and the initiative, the Pulmonary Hypertension Breakthrough Initiative, is an initiative that tries to take explanted lungs from patients with the disease at the time of transplantation and process that tissue and get that into the hands of scientists so that they could study the basic mechanisms of the disease in human tissue rather than animal tissue. And we're so hopeful that this may make important breakthroughs over the coming year. So we've made so many advancements. We have now more than a dozen therapies that work in 3 different ways, and we are starting to understand how to best use those therapies. But pulmonary arterial hypertension has many more mechanisms than that. Those 3 pathways are just the tip of the iceberg, and we need therapies that target new mechanisms, new pathways, so that we can add on to the current therapies that we have. So the World Symposium on Pulmonary Hypertension Association is the base for continuing this meeting, but there are lots of other participants that are critical. The physicians, the scientists, the researchers, they really formed the basis of the meetings that we've had and will continue to form the basis of the content and the future directions, the things that we discuss at the meetings, the recommendations that are made. And I think it's really critical for those who are as passionate about pulmonary hypertension as we all are to really join in our initiative here to continue the momentum that we have going. I'm passionate about the patients. I've been very involved in the Pulmonary Hypertension Association at the U.S. Level, and bringing the patient associations in and the patients in and the caregivers in is really critical. We had a great example of that at the 2018 meeting when we had that first task force on the patient perspective, and there's so much room to grow there as well. And those individuals, the patients, the caregivers, the patient associations, may also have ideas that are important to incorporate into subsequent meetings. I feel so fortunate to, with Lou and Gerald and Nazareno, be starting this association, but that's just the start. There are so many professionals, physicians, researchers, allied health professionals that are passionate in pulmonary hypertension, want to be involved, want to make a difference, want to see this Congress grow, want to see our meetings grow and take on directions that need to be taken on as we make progress, as science evolves. And people getting involved and contributing and helping to direct the future of the meetings is really what this association is all about.